Hi, Instagram. I'm Dr. Elizabeth Sherwin, a cardiologist at Children's National. I specialize in electrophysiology, or the electricity of the heart. This means arrhythmias, cardiac devices, pacemakers and defibrillators, as well as inherited heart rhythm disorders. My day-to-day varies greatly, but consists of many different activities, including outpatient clinics in Washington, D.C. and Virginia, electrophysiology procedures such as cardiac ablations, and inpatient arrhythmia management for children admitted to Children's National. I'm here to talk about returning to school during the pandemic and what that may look like for some of our patients with heart conditions. So let's get started. So first question, is it safe to return to school? That is quite a question, as evidenced by the fact that we've been out of school for a year around the country, and there's so many debates going on about the timing and safety of return to school. It's certainly not easy. There's so many factors to take into consideration for keeping children, teachers, as well as staff safe. We have to weigh the risks and the benefits. We also need to acknowledge that there's many risks for some kids to not be in school. Being at home works for some students academically and socially. I'm seeing a huge burden of mental health stress and academic struggles for kids who are doing distance learning. In my opinion, it's really important to take into account the mental health of this generation and our kids and try to get them back to school. While some modifications have to be made to classrooms, with these modifications, with social distancing, masking, hand washing, as well as people staying home if they've been ill or not feeling good, or if they've had a known exposure. If we do all of those things, I do believe and feel that it would be safe to get kids back to school, and hope that that can happen as soon as possible. So talk with your school about what precautions are in place. In the meantime, stay active, get up, move around, try to do some exercise and get some fresh air. This can help prepare you for the activities of getting back to classroom and out of the house, minimize fatigue and dizziness, and keep your overall health up to date. Okay, is my child at higher risk because of their heart disease? This is a very individualized question. For the most part, we think no. Many children with heart conditions are not at higher risk of acquiring COVID or any other virus for that matter. However, there's going to be unique situations. There's some types of heart disease which will make it harder if they get a respiratory infection, and they may have more significant respiratory symptoms. There are certain medications that can be used or side effects from the virus that may affect someone more significantly than another child. But it's really individualized, and many of our patients with heart conditions will be able to tolerate a mild infection just as any other child would. So I encourage you to talk with your child's cardiologist or your cardiologist about your unique situation and how this might affect you individually. Okay, does COVID affect the heart rhythm? Yes, it can. Not everybody, not majority of patients will have an arrhythmia, but we are seeing heart rhythm disorders in adults and children who have COVID infection. We're also seeing this in the MIS-C population, the multisystem inflammatory syndrome in children, which is the illness that occurs 4 to 6 weeks after a COVID exposure. Again, it's not the majority, but it's a possibility. Signs of an irregular heart rhythm include palpitations or feeling something different with the heartbeat. It might be a skipped beat, a thud, a pounding, or heart racing. These symptoms are not specific to COVID, but they're worth discussing and could have many different etiologies or causes. So report these to your provider, have an evaluation. Certainly, if an individual is diagnosed with COVID and those admitted to the hospital have heart rhythm monitoring. Even a mild COVID illness that does not require hospitalization, we should be aware of the possibility for an irregular heartbeat, and if you have symptoms, report those. Is it safe to visit the hospital for a cardiac appointment? Yes, we are here. It's really important to come to visits, whether that's a new visit or a follow-up, to take care of your heart and to have evaluations that are needed. We're open. We do have in-person clinics, both at the main hospital, but also around the region in our satellite clinics in Maryland, Virginia, and DC. These tend to be smaller locations, not in a hospital, and potentially lower risk or feeling that way for some people. We're also doing a lot of telemedicine. So you may be able to be seen without even leaving your couch. At the main hospital, for those who come in, we're following all guidelines. Staff are wearing both masks as well as eye shields. Each patient who's admitted to the hospital has COVID testing prior to admission or at admission, and even outpatient procedures. Those patients are getting tested first. So the risks are very low. As a standalone pediatric hospital, we have lower numbers as well, as it goes with the general population and what we're seeing around the world, that children are less frequently or severely affected. And so our numbers here at Children's National are quite low. Overall, we have lots of ways to help keep your visits safe, to keep you protected, and to keep all of our staff protected. So by all means, don't ignore your heart. If you need evaluation, we're here. If you're not sure, give us a call. We can always talk about it and help make sure that you're protected and covered. Okay, that's it. So it was wonderful talking with you. Thanks for listening and enjoying this episode of Bear Bites. If you have any follow-up questions, please feel free to contact my team at 202-476-2020. Take care.